Good morning. Happy Mental Health Month of May. I am so excited to talk with you all about postpartum mood disorders, how we can understand them, how we can talk to women and their partners about this, and then Janice is going to talk about some of the resources in the community and our First 1,000 Days initiative through Sarasota Memorial Hospital. All right, let's see. How do I get this? Oh, there we go. Can y'all start the video, please?
Pressure pushing down on me, pressing down on you, no cure is for. Under pressure that brings a building down, splits a family in two, puts people on the streets. Hey there, hey there. Pressure pushing down on me. Pressure under pressure.
Just watching that really touches me. And it started for me 23 years ago, but it's still so real in my experience. So, life changes with a baby. Any mothers in here know that. But nothing prepares you for that change, no matter how many classes you take, no matter how many stories other mothers tell. You think it won't happen to me. I'm gonna be different. And I'm gonna tell a little bit about my beginning as a mother. My quest for children began later in life. And my husband and I struggled with infertility. So we struggled for a long time to have a baby. And then finally, after about 1.5 years and a couple miscarriages, we had a baby. And it was all I ever wanted. It was what I dreamed of and what I hoped for. And also, I believed when I was pregnant that me and my newborn were going to be able to go golfing together. Pretty unrealistic, huh? My highlight when I was a mother of a newborn was going to get the mail out of the mailbox. And then a friend of mine said, you gotta come to this group at Sarasota Memorial for new mothers. You gotta do it. And so I did it, and I'm an extrovert. I'm like, let's go to a party. I'm energized by that kind of thing, but it was still even hard for me to get to that group. But I went, and my life changed. The whole trajectory of my life changed, because not only did I find my purpose and connection as a mother, I found my purpose in life. But here's the moment that changed everything for me. We're sitting in this group, and we would all go around and we would share what was going on. And this other mother, who was one of my best friends 23 years later, said out loud, I can't believe this is what I wanted. And I thought, oh, thank you. I'm not the only person struggling with this as what I wanted. But it was. And together, 23 years later, I have a core group of mother friends, and many of us have just graduated our firstborns from college. But that group grounded me, and it gave me purpose for my life. Because from being involved with that group, I became a childbirth educator at Sarasota Memorial Hospital. I did that for 13 years. I was a lactation consultant for Healthy Start. I did that for 12 years. I was a parenting educator at 40 Carrots. I was a parenting educator at JFCS, and I have finally landed, and I swear this is the last job, folks. I'm at the Florida Center for Early Childhood. I provide mental health services for the Healthy Families Program, which is a home visiting program for at-risk mothers, and I'm also an outpatient mental health supervisor. I have found my life's calling for 2.5 more years, but who's counting? I'm already getting my Medicare cards in the mail now, okay? So enough about me. Life changes with a baby. And here are the normal challenges. No sleep, and that goes on for about 6 weeks. Babies get their days and nights mixed up for about 6 weeks. And I like to tell moms, this is normal. This is nature's way of protecting your baby. In their most vulnerable period, they need 24-hour supervision, and they get that by keeping their parents awake at night. The lack of confidence. You know, as a lactation consultant, I'd be like, you're not gonna break them, but you're so afraid of that. And there's this pressure to be perfect. I'm so lucky because with my firstborn, that was in 2001. I don't know if there was Facebook then, I don't think so, but I didn't know about it, so I didn't feel that pressure. My pressure came with everybody having the best birthday party ever. It's normal for babies to cry. We all think a baby wakes up, they eat, they go to sleep. Yeah, some people are blessed with babies like that, but a lot of us aren't or weren't. Breastfeeding can be hard. And what I like moms to know is that most women don't feel any level of confidence till about 4 to 6 weeks. And so I used to tell moms when I would visit them, get a Sharpie, and I want you to write right here, it gets easier. And then on the other side, you write, this is a phase. But it does get easier. It's upsetting not to be successful at breastfeeding. There is real grief and regret when you cannot be successful at breastfeeding and women get told, you had formula and you're fine. That doesn't help, okay? There is grief associated with that. Having a baby is nothing like what you expected, hence no golfing. My son is 23. I think I've golfed 10 times since then, and I love golf. A difficult birth or a C-section can be traumatic and cause grief. I had twins after my firstborn. I had one the old-fashioned way, vaginally, and I had one by C-section, and I grieved that C-section. I couldn't even watch them on TV. I would be triggered by that. Moms and dads' progression in parenting is very different. It's really interesting. Most dads, and I'm not gonna say all dads, but there's something magic that happens right around 9 months when dads kind of start getting the hang of being a dad. Isn't that interesting? 9 months for mom and 9 months for dad. It's common for moms and dads to feel they're working the hardest. I remember this so well. You're going to work and you get to have lunch and you get to talk to other adults, and I'm here with the kid all day crying and nursing, and I don't sleep, and he's thinking, I go to work, I don't sleep. And what I tell families is everybody's working the hardest. Nobody has an off shift when you have a baby. And there's too much advice. So I learned this in a parenting class. People give you advice. You say, thank you, I'm gonna think about that. And you don't ever have to think about it again, but it kind of shuts them up. 80% of mothers will experience the baby blues. And there's gonna be emotional ups and downs. The emotional fluctuations may be mild and decrease within a few weeks, or for some may be overwhelming and will require assistance. The emotional changes, and I like moms to know this, it's hormones, baby. Extreme change in hormones, extreme level of fatigue, lack of confidence, feelings of disappointment about the birth, lack of assistance, and this is such a big one, isolation. We don't have our villages anymore, and we need a village when we are a new mom. Baby blues typically happen within the first week after birth. So, mom's milk comes in somewhere between day 3 and 5. And guess what? I tell moms, tears come with the milk. That's just how it is. It's that hormonal shift. What are the symptoms? Mom cries easily. I remember this. I remember taking my newborn to the pediatrician, and she said, "He's so handsome," and I burst into tears. That's normal, all right? Feeling overwhelmed, exhausted, anxious, lack of confidence, and then there's the relationship stress that comes with a new baby. What's important with baby blues is they're temporary and they rarely last longer than a week or 2. So what do we tell moms to do? Sleep when the baby sleeps. If someone is there, don't give them the baby to hold while you work. You hold the baby, or you go sleep while they hold the baby and try and do some loads of laundry for you. Manage any physical pain. So many moms feel like they can't take pain medication after a cesarean delivery. And the medications that Sarasota Memorial sends mom, or any hospital in the area sends moms home with, are safe for breastfeeding. I tell moms, ask for help when you need it. There are 2 times in our lives when people really want to help us, when someone's born and when someone dies. Let's take advantage of the happy one. And connect with family and friends. Connection, connection, connection is so important. But then, baby blues don't pass, and we have what are called postpartum mood disorders. I don't want to call it postpartum depression anymore because it's so much bigger than just sadness. It can be depression, it can be high levels of anxiety, OCD, agitation, anger, and rage. That's one that can really be surprising for new mothers. Insomnia, mania, non-psychotic intrusive thoughts. Moms can have these really weird thoughts, and they don't want to tell anybody because they're so intrusive and strange. So, I was a lactation consultant, but I went in as a mental health therapist too. You know what? Some moms have some really strange thoughts. Like, what if I was accidentally dropped a knife and it hit the baby? Like, they weren't thinking of taking a knife. It's these weird intrusive thoughts, so I like to normalize those. There can be over-the-top protectiveness and hypervigilance. We can see an increase in alcohol and drug abuse and PTSD, especially for victims of sexual assault and sexual abuse. The whole birth process can trigger lots of feelings about that. What are the risk factors for postpartum mood disorders? Previous postpartum mood disorders, especially if untreated. Untreated postpartum mood disorders typically come back and they get worse with each subsequent pregnancy. If a woman had prenatal anxiety, maternity blues, or depression, a history of depression, low self-esteem, isolation, decreased relationship satisfaction can be a risk factor. Life stress, feeling out of control, well, everybody has that after a baby. Childcare stress, unplanned pregnancy, unwanted pregnancy, the colicky baby can push a woman kind of into the postpartum mood disorder. Single mothers, low socioeconomic status, birth trauma or infant loss and miscarriage previous. So postpartum mood disorders can hit early after birth or later after birth. It's especially can happen when a woman weans from breastfeeding. Again, hormones, baby, okay? So it can also be increased family stress. You know, dad returns to work. Visiting family member leaves. I still, to this day, remember my mother packing up her bag to go back to Texas, and every time she put something in the suitcase, I cried. Because my main support was leaving me. Moms returning to work. Now, some moms are like, oh yeah, I'm ready to be back at it. But some women, it is gut-wrenching making that decision to put your child in daycare and return to work. Babies with special needs, moms are at greater risk for the postpartum mood disorders, illness or hospitalization, loss or grief. And it could be a loss of a family member during the postpartum period, or it could be, of course, a loss of a child, or even just a previous loss. So women are so reluctant to talk about this. I think it's better than it was 23 years ago. But women don't like to talk about it being difficult when they're supposed to be happy because they just had a baby. So here are some ways you can start the conversation. Tell me your birth story. It is a developmental task that women need to tell their birth story again and again and again. It's just a need that a woman has. So that's how we can get started. Tell me about your birth. How are you feeding your baby? How do you feel about it? It gives us that opportunity to support a mom who's grieving not being able to breastfeed. What's sleep like at your house? Oh man, there's no tired like newborn tired. Any disappointments about the birth? Let's talk about the birth trauma. How has your recovery been from your C-section? How do you feel about having a C-section? Some women have a C-section and they're like, I'm just glad it's over with. I'm moving on. Some women really grieve that, you know, Vaseline on the lens, Hallmark card birth. And a C-section can really cause grief. And I'm going to tell you, I can't remember if I have this on a slide later. It is not helpful in any way, shape, or form to tell a woman who had a C-section what's most important is a healthy baby. Duh. That did not help me. So I used to tell women, somebody says that, you have my permission to throw a shoe at them. All right, not helpful. Do you have any family around to give you a break? Are you home alone with the baby? Do you have friends and family for support? Was anyone here to help you when you came home from the hospital? How was it having your mother here? I mean, it can be great, and maybe it's not so great. My mom came and stayed for about 6 weeks, a little bit before I had my twins, and then after I had my twins, and it was time for her to go home. And I love her, but it was time. Some more, starting the conversation. Were you working before your delivery? What's your plan for work? What's it like for you not to work? What are your thoughts about daycare? How's your partner adjusting to the baby? I've talked with a number of moms that had strange thoughts about the baby. Some of the thoughts were hard to share. I want you to know that these strange thoughts are due to postpartum hormone shifts, and this is a safe place to share those thoughts. I'm not calling anybody and reporting you. More conversation topics, lots to talk about. What did you do pre-kid for fun? You having any fun now? Were you an active person before the baby? How active are you now? I mean, I have moms who are runners, and they have a C-section and they can't get back to running. That's really hard for them. Are you getting out of the house? Have you heard of community activities for moms and babies? Tell me about your baby. Look for connection moments between mom and baby and point it out. We talk about those angel moments. And if you see it, take a picture of it, because they may not be feeling that connection. How do you rate your stress? How do you think you're doing as a mom? And this is from a book, Valerie Ruskin. This isn't what I expected. Oftentimes, the main difference between the mother who kills herself and the one who doesn't is when they believe it'll be better for the baby. She says, the thing that raises the hair on the back of my neck is a woman who tells me baby will be better off without her. She is at a very high risk for suicide. I'm going to have a little soapbox moment here, because I'm a lactation consultant in my heart forever. So many women have been erroneously told that they cannot take certain medications and breastfeed. And a woman should not have to choose between mental health and medications to treat her mood disorder. The Infant Risk Center is out of Texas Tech University Medical School. Laura Bush funded it. And they are world leaders in doing research on medications, pregnancy, and lactation. They are staffed by pharmacists and other medical professionals. The call is free. They're open 9 to 5 Central Standard Time. They will look at a medication and they have a scale, L1 to L5. L1 is compatible. I'm pretty sure Zoloft is a L1, okay? L5 is hazardous or unknown. And I will have moms go to their OB and they will say, I need medication, and they say, you have to stop breastfeeding, and she doesn't want to stop breastfeeding. And I had one mom go and she said, let's call this place, and the doctor said, no, I'm not calling some other place. I believe they can call the pharmacy also at Sarasota Memorial. I know that was available in the past. But this is all this agency does, is research. So please, please help us educate medical providers that there is a resource so moms can get the help that they need. Risk factors for postpartum in dads or other or partners. So if they've had that in the past, if they have a personal or family history of depression, low levels of marital satisfaction, I'm sorry, after you have a baby, it is not all love and roses. It is don't touch me, and you take out the trash, and don't touch me, right? Financial stress, life stressors, lack of outside support, dissatisfaction with partner support, poor communication between parents, and dads can feel really excluded in the bond between mom and baby, especially if there's breastfeeding. And I have seen some dads kind of sabotage breastfeeding because they feel left out. One of the things that I loved when I was a childbirth educator at Sarasota Memorial is having the dads come take the baby care class, so they got to practice all those things and have a little more confidence. The critical message is, you did not cause this, you are not alone, and with help you will get better. I literally say these words to moms when I visit them. It's not your fault, you're not alone, and with help you will get better. And that's my part. So thank you for listening. I'm gonna hand off to Janice now.
Thank you, Jeanie. Okay, Great information, but you may be asking, what is the prevalence of this? So we can say national statistics show that 1 in 7 moms are going to experience postpartum depression, 1 in 5 having anxiety, and dads are not left out of the picture. 1 in 10 of them will experience depression and anxiety. If we move to some more local statistics, First 1,000 Days is out of Sarasota Memorial Hospital. They're our backbone organization. This is data from SMH. And 1 in 6 moms who delivered at the hospital were diagnosed with a mental health concern. 1 in 5 babies who were born prematurely were born to a mother with a mental health diagnosis. And 1 in 4 babies who had an extremely low birth weight were born to a mom with a mental health diagnosis. So you can see there is a significant connection between mom's mental health and baby's physical health. And that's why it's really important that we lay a strong foundation for our little ones. If we invest earlier and give them a healthy start, that is going to create a positive trajectory across their whole lifetime. So building those early developmental milestones is critically important. And how mental health plays into all of this is there is, from pregnancy to lifelong, I'm just gonna walk through this quickly, but there are moments in time where we can all support a mother and that it's gonna support the child. At pregnancy, any depression, anxiety, or stress is going to impact the baby. And you saw the statistics. It really puts them at risk for premature weight, for example. Let's skip to infant. Mom's depression can really interfere with that child-parent attachment, that bonding. And that is so critical. This lays the foundation for being able to connect, that social emotional development, really that brain stimulation, that brain development, which is so critically important, because if you've not heard the statistic before, by the age of 3, 80% of a child's brain is fully developed. And by the age of 5, 90% of it is fully developed. So we need to support the child emotionally, cognitively, right from the start, so that they can really be more prone to experience success in life. And then if you skip forward to the lifelong health and wellness, growing up in a household with a parent or a caregiver who has a mental health issue is considered one of ACEs, the Adverse Childhood Experiences. So it's important that we all support. Jeanie talked about the lack of family support and how critical, important that is. We need to support our families and make sure that they're getting the care that they need. I'm going to skip through some of these slides. I think Jeanie covered all that. Let's talk about what keeps moms and dads from getting the help that they need. So lack of awareness. Jeanie had some wonderful examples of people thinking, oh, this is just me. This is not something that is typical. Stigma is a huge thing. And you mentioned social media right now with everybody looking like they have happy, wonderful families and a perfect childbirth experience. There's so much pressure. And that's just not the case. And we have heard moms say that they have felt guilty for not being happy. You know, I just had a baby. This is what I dreamed about. This should be the happiest time of my life. And yet, I feel like crap. You know, I don't feel like myself. I'm not having fun. I am tired. I'm burdened. And so they feel guilty for feeling that way. So we need to raise awareness. Access and the cost of mental health services, I'll talk about this in a bit, but that is something that is coming up as a barrier. Sometimes when parents maybe realize that they need help, they're not sure where to reach out for help, or when they do reach out, they come across barriers. There may be long waiting lists. They may not have insurance, or the provider they want to go to doesn't accept their insurance. So there's all kinds of barriers. Cultural expectations. This plays a significant role in if it's okay to reach out for help outside of your family. And then, of course, mentioned feeling tired and overwhelmed. So I wanted to talk a little bit. We've talked a lot about the needs. We've talked a lot about things to look for. But let's talk about the resources that are available in our community. And I feel like we're fortunate to have many here in Sarasota and in our Suncoast area. First 1,000 Days is a tri-county initiative. So we're in Sarasota, Manatee, and DeSoto counties. And we work alongside of over 90 community partner organizations, the Florida Center and 40 Carrots being two very key partners. But we all work together collectively to support families in their journey from pregnancy to age 3. And we do this in a couple of different ways. We have family navigators that will connect families to services, but also as a community, we will convene and we will talk about what are the barriers in our community and how we can work together to find some solutions. So one of the examples I've referenced earlier is moms were telling us how hard it was to get help. Okay, I realize I need help. I can't find it. And professionals were saying the same thing. We have limited staff. We've had a huge turnover. We can't, we have a wait list. And so in recognizing that we needed to do something, a work group pulled together and came up with these 4 objectives. And one of them was that we wanted to create a place where anybody who is struggling would be able to reach out and feel safe and not feel that stigma and get connected to services in a more streamlined manner. We wanted to create public awareness about perinatal mental health and to reduce the stigma. And so to that end, we have a social media campaign. And every year we have moms who are reaching out and asking for help. And we have some parent leaders who help our initiative, and they have been instrumental in giving us the words that we should use that they feel are going to resonate with other moms. We came up with this whole social media campaign and asked for their feedback, and they're like, no, that means something different to me. So their words have really helped us reach other moms and dads who are struggling. And then the work group continues to meet on a quarterly basis, and we talk about our wait lists and the barriers that we're experiencing. And what is really cool that has come out of it as a number of organizations, after hearing the gaps of services in our communities, they have either expanded their programming and what they're doing, or they've started a new support service that they haven't offered in the past. So that's been a really wonderful product of the group getting together. And then lastly, the 4th objective is really advocating for more screenings. A lot of families may be slipping through the cracks. We did perinatal focus groups with moms, and it was kind of concerning, the number of mothers who said they went into their appointments throughout their whole pregnancy and never once did anyone ask them how they were feeling emotionally. Did they have the supports? Were they getting what they needed? And so we want to advocate for more screenings in both medical settings and in social service settings where appropriate. So how our hub works is we have family navigators, as I mentioned, and parents can reach out. They can call. They can fill out a form on our website. They can email. They can text. However they reach us, our navigators are going to assess them, do a comprehensive assessment, and then get them connected to the resources that they need. And then they're going to do a follow-up in 60 days, just to make sure that maybe no additional issues have arisen, or that they have, in fact, got connected to the supports that they need. We have, again, many of our wonderful partners here today. We make...
I think we have 5 minutes.
Okay, okay. All right, I'm going to wrap this up. Thank you, Jeanie. These are the different type of supports that we refer parents to. A nice balance, and we're very excited. I do want to announce that Sarasota Memorial Healthcare System has a new pregnancy care team where we have OB nurse navigators that will connect moms to prenatal care. If they need any specialized medical services, they'll make sure they get connected, as well as other community supports. The telephone number's up there. It's free, it's confidential. We do have some flyers over there on the table for First 1,000 Days and for the pregnancy care team, so we hope that you will reach out. And here's our contact information. I don't know if we have time for Q&A, but if there's any questions following this presentation, please reach out to us. Thank you.
We have a little bit of time for questions. So I'll talk a little bit more. One of the things that is so important is that pediatricians become a part of the screening process, because moms finishes up with their OB at about 6 weeks, 8 weeks if it's a cesarean delivery, and pediatricians see them on a very regular basis. So we really want the pediatricians to start asking those questions. The other thing is, if screens are given, they need to be read and scored. I worked with a mom who went to her OB and said, I think I have postpartum depression. And they said, well, we did a screening, and they pulled it out and they never scored it. So screening is really an important part of the process. Okay. Thank you all for listening. We are so thankful. Oh. No?
Someone had a question? Yes, sir. He's asking, what is the importance of nutrition for young children? Asking about education, about nutrition. Okay.
Yeah, I don't hear real good, so I told Janice to be my ears. Right. So I would not make that recommendation because that is not my area of expertise, but I would certainly refer them to their primary care physician. WIC does a whole lot of education about nutrition, and I'm with you. Gut health is so important, but I have to kind of stay in my lane. So if someone had questions for that, we might look for resources to get more information on that. But I'm with you. So PSI International has a website that is in every language, and there is a hotline that in all languages help is available. In Sarasota, I know that our Healthy Families Home Visiting Program has Spanish-speaking peer visitors, and we have a Spanish-speaking mental health therapist. Very limited spots for that. So PSI, Pregnancy Support International, every language. So and they have online support groups for moms, for dads, LGBTQ, they got it all. So I would refer someone who had other language needs there.
And I would just add that if you're reaching out to the OB nurse navigators or to First 1000 Days, the website can be translated into multiple languages. We also have bilingual staff. All our promotional materials are in both Spanish and English, and the hospital has access to the language line, so we can definitely connect parents with a variety of different languages to services.
Amen, sister. You know, we need to speak our own language because there's nuances in language that even if it's your second language, you may miss some things. So PSI.
Thank you, Janice. Thank you, Jeanie. We appreciate it. Thank you. Thanks. Fantastic.